Hey guys, this is Dr. Kyle with Ice Clinics bringing you your next tip for Tuesday. I'm going to cover a subject today that I think I bounced around with our other videos in the past that all revolve around the knee, and that is the subject and the diagnosis known as Chondromalacia Patella. It's a really fancy word, but it essentially means that you have on the underside of your kneecap, you have these two sides of it, which are called your facets. These facets have a cartilage on them, and for that cartilage to be maintained and healthy, it has to line up with the top side of your femur bone, so your thigh bone that comes up this way. If it doesn't fit within this groove, say when you're bending your leg or straightening it out, those facets will kind of grind up against your thigh bone, and that creates an irritation to the cartilage, which typically wears it down. Now the problem itself, so the diagnosis Chondromalacia Patella is not really the issue. It's kind of the result of the issue. The issue typically relies on some neurologic and biomechanical issues that involve the hip, so way up here, and then the ankle way down here. And they kind of manifest in the middle, which creates an issue around the knee, and this guy doesn't track properly. Probably the most common thing that we find in here is that there's a rotation component to the knee. So basically the thigh bone will twist in one direction and the shin bone will rotate in the opposite. And what that does is that little groove, that kneecap has to slide up and down, it kind of makes it staggered. So when you do bend your knee, it's like you feel it maybe grind typically on the inside or sometimes on the outside of the knee. And every time you straighten and bend it, you keep feeling that grinding sensation. Well, that should be a sign to you that, hey, something's not lined up quite right. I'm probably causing damage to that cartilage, which can cause me issues and pain down the road. So very simply, what we typically do in our clinic is we work on the mechanics of the hip and the low back, and then downwind we work on the mechanics of the ankle, trying to make sure that everything lines up. A lot of times that, I think, fixes the underlying cause of why we have our knee issues. So something especially like if you've been struggling with a knee issue for a long period of time and you've been diagnosed with something like Chondromalacia Patella, but you haven't really had your answer, it probably means we need to zoom out away from the kneecap itself. Because like I said, very rarely, at least in my experience, is the knee itself the problem. So I have two little tips to give you guys as far as trying to balance this out if there's an issue for you. Real simply, we need to strengthen the muscle called your VMO. It's part of your quad muscle. It's right here on the inside of your knee, and it looks like a teardrop. If I was wearing shorts, you might be able to see it a little easier. But this guy, the strength or lack of really dictates how well this kneecap tracks. So one real easy way you can do this at home when you're sitting in a chair is to try and lock your knee out with your toes pointed up, and then you try and turn it out just slightly. You should be able to poke on that and feel that bad boy firing. And then you can just do a few repetitions like this. But again, the key is making sure your knee can get all the way straight. If it's even just slightly bent like this, you can't really recruit that muscle. One other way, if you're a little more advanced and want to recruit that muscle, is you can get a wide stance, turn your legs out a little bit, and practice doing some squats. They don't need to be big, but when you come up, again, locking those legs out, feeling that muscle engage. So you can do a few repetitions if you feel you're advanced enough to do that. But that should really help any of you that seem to be having this problem with your kneecap. And like I said, if it's a little more advanced than that, don't hesitate to give us a call and see if we can't help out with our extremity approach. My name is Dr. Kyle with Ice Clinics. Thanks for watching.